Good evening, everyone, and thank you for coming back. We have had a great time since July 9th talking about maternal deaths and the causes for maternal deaths, discussing the root causes, because many of those causes are preventable. I am particularly concerned about the rate of maternal deaths in the United States because it's affecting women of color and particularly Black women. Black women are dying at more than 2 times the rate of white women. And so I have been dedicating my time to bring everyone's attention to this, but also to educate women and their families about what occurs during pregnancy, who are different types of providers that can assist them during pregnancy and the birth process, to consider the best location for birth, and to empower them to be able to be more actively involved in decisions related to pregnancy and the birth process. My name is Carolyn Curtis. I'm the CEO and founder of the CARAB Company. Tonight, we're going to talk about the normal anatomic changes that occur in a woman's body and the complaints that happen because of these changes. But before we get started, I want to bring your attention to the beautiful medical illustration that was on the invitation for tonight's episode. That illustration is done by Mr. Chedebere Ibe. I hope I said the name correctly. He's from Nigeria. He is a medical illustrator. He's also a medical student with a desire to be a pediatric neurosurgeon. He's at Brigham and Women's, that is under Harvard Medical School. So we want to thank him for bringing and illustrating people of color. That is his desire. As I read about him, he said, I couldn't see people like me. And so he has made the decision to do medical illustrations that show people of color. If you go to Instagram, you'll be able to find out more information about him and all of his beautiful, beautiful illustrations. So tonight, let's talk about these normal anatomic changes. Hold on for 1 second while I pull up some slides. It's so important to understand your body and to understand what are the normal changes that go on in your body during pregnancy. There is so much that goes on within that 9 months. The hormones have an interplay and they cause a lot of changes in your body. They cause muscles to soften and relax. And it's just an incredible thing that goes on within a woman's body during this time. Ben, I'm sorry. Y'all just don't get this experience. But our bodies are like, wow, really, really incredible. So as we look at this chart, I want to start on the left-hand side to look at what a woman's body looks like normally prior to pregnancy, and then to compare to see what are all these changes once pregnancy has occurred. And over, this looks like we're about 9 months in pregnancy. We're going to start at the top. You can see the breasts on the left-hand side. The gray area that you see at the very top is the lungs. Right below that is the diaphragm. The diaphragm is a muscle. Below the diaphragm, you're going to see the stomach. The liver is also there. Below the stomach, as you can see, that accordion-like shape is the intestines. That takes up a lot of area in this whole abdominal area. From the intestines are connected to the rectum so that food, once it enters the body, is processed. You get pulled out all the nutrients, vitamins, all the good stuff that your body needs. And then the waste goes out through the rectum in the form of a bowel movement. The pink area that you see under the intestines that looks somewhat like of a U shape is the uterus. And the uterus has an opening called the cervix. The vagina is where the uterus empties into the vagina. Right under the bladder is under the uterus, is the bladder. I want you to see that. And now I want you to go to the right-hand side and look at all of these changes. Oh my goodness. Look at the breasts. You will see some of the yellowish detail around the blood vessels that have increased in size. You see that the breasts have enlarged. That is to get the body ready for breastfeeding. You'll see that the lungs have been pushed up. They're pushed up compared to on the left-hand side. The diaphragm is also pushed up. The stomach is also pushed up. The intestines are smushed up. You see the uterus, you see this pinkish area. Inside of the uterus is the bag of waters, is the baby. The umbilical cord is inside the bag of waters, which is inside of the uterus. I'm going to emphasize that one more time. The umbilical cord is inside of the bag of waters. The bag of waters is entirely inside of the uterus. At the bottom of the uterus, which is the opening, you see a little slit that looks like whitish there. That is known as the mucus plug. You'll hear more about that when it comes time to talk about labor. That empties into the vagina. And if you go and see where the rectum is pushed backward a bit. It seems to be maybe squished a little bit. Look at the bladder. Oh my goodness. The bladder seems to be a lot smaller in terms of its capacity to expand. And that's because the baby is sitting right over top of the bladder. What I want to do is to now walk through some of the normal complaints that women have because of all of these changes that have happened in the body. Now, keep in mind that this is looking at over a 9-month period. We're not going to go from here to here in a couple of days. This is a progressive situation over a 9-month period. Some of the first complaints, and also, as we talked about last night, sign of pregnancy is nausea. The nausea is caused by hormonal changes in the body, and the nausea is normal. It's a sign of pregnancy. Nausea can happen and be normal up until 4 months of pregnancy. As I mentioned in our episode last night, it's very dependent. Every woman is very different. Some women may have nausea in the morning. Some women may have nausea only at night. Some may have nausea all day long. That is normal. It's possible for some vomiting to happen, but we don't want vomiting to be so much that you cannot keep down any of your meals. That is when it's problematic. Now, there is a tube that goes from the throat down to the stomach, known as the esophagus. There is a muscle at the base of the esophagus. As it goes into the top of the stomach, it's known as the pyloric muscle. You cannot see it on this diagram. The next complaint that women may have, and these are not going to be in any particular sequence, but it is a complaint that women can have called gastric reflux. The gastric reflux is caused because that muscle, because of changes in the hormones in the body, has relaxed a bit. Usually that muscle is tightly closed. Once you eat food, it tightly closes. so that the food does not come back up into your throat. But during pregnancy, the hormones cause the muscle to relax just a bit, where you're able to get some reflux of some of the gastric juices in the stomach. And so women may complain about the reflux. Now, what can be done with that is to stop eating greasy foods. That's one. The other is to make sure that you're not lying down after you eat. As you notice, the intestines are kind of squished. The whole processing of food is slowed down a bit. And so you don't want to lie down as soon as you have eaten. Some things you can do, sometimes milk will help with this. Antacids can help with this. So let's move to the next thing that can be a problem. The next thing that can be a problem is the possibility of constipation. And as you can see, the intestines are squished. As we just talked about, the whole digestion is slowed down because of position and also, again, because of hormonal changes in the body. It's a slower, as we call it, a slower emptying of food out of your body. If you're not drinking enough water, even when you're not pregnant, if you're not drinking enough water, you can become constipated. But pregnancy, it's exaggerated a bit more. So what is the remedy with that? Drink a lot of water. What is a lot? It is recommended 12 8-ounce glasses of water a day. That means drinking at least 1 8-ounce glass of water every hour. And that will really help to prevent the constipation. If you're taking iron tablets, the iron will cause constipation. So you really do need to drink more water. The other is to eat foods that will help prevent constipation. Those foods being apricots, prunes, plums, raisins. Those are things that can help prevent. Also cherries. I ate cherries. Oh my goodness. I really had good results after eating cherries. So those are foods that can help to prevent constipation. The next thing as we move down is, as we look at the bladder again, the bladder as the baby gets larger is right underneath of the uterus. It has less room to expand. And therefore, if it's unable to expand as much as it would when you're not pregnant, then your need to go to the bathroom for urine is going to be more often because your bladder can only hold so much at a time. So that's another common complaint, is this frequency of urination. You would notice that more in early pregnancy and also later in pregnancy. If you begin to have burning when urinating, that is a problem that you need to bring to the attention of your medical provider. It could indicate a bladder infection. Now, the other thing with the lungs is sometimes women can say, I'm having trouble, particularly as the baby gets larger, like taking really deep breaths, all right? One recommendation is to put the arms out and to the side and over the head, because your lungs are then able to expand to the side. It no longer has the room to expand downward when you were not pregnant. Now, there's an old wives' tale that says, oh no, you can't lift your hands above your head because that's going to cause the cord to get wrapped around the baby's neck. Now, let's see if that's actually true. Let's look at the anatomy again. Now, think about this with me. If the cord can get wrapped around the baby's neck when you raise your arm, that would mean that your arm has to somehow have some kind of connection to the baby's umbilical cord, right? Let's look at the anatomy. Understand what we said before. Oh my goodness, here we go. The umbilical cord is inside of the bag of waters, which is inside of the uterus. The umbilical cord does not go outside of the uterus until the baby is born. So there is no connection of the umbilical cord to the arms. So I don't think when we look at the anatomy that it's possible that the bag of waters is going to get wrapped around the baby's neck if you put your arms above the head. So put your arms above the head. Don't worry about it. It's not going to affect the cord around the baby's neck. The thing of it is that the cord around the baby's neck happens very frequently. It's one of the first things you check for when a baby is being born. And you cannot control that. It depends upon the length of the cord. It depends on baby's movements. You can't control those things. So it happens so frequently that that is the first thing you check for when the baby is being born. Now, the other complaints that women have are muscle complaints. And women may complain about muscles that are kind of lower abdomen in kind of the pelvic area, and also low back pain. The uterus is held in place by bands of muscle called ligaments. You have the round ligaments towards the front, and you have a broad ligament, which is a much thicker muscle that connects the uterus to the back. Now, the uterus does not just sit in place. The uterus moves around. These muscles just hold them in place, but the uterus does move around. So some of the things to do to help relieve this is we tell you to be very careful with how you have your posture. That when you get into a car, oftentimes we'll get into the car, we'll put our foot in first, then our body, and then bring the other foot in. Well, we'll tell you to be what one might think of being very ladylike, where you sit down on the seat first and then swing your legs in. That will save this pulling of the uterus. And this gets worse as the baby gets larger. As you can see, this uterus is here, okay? I mean, the uterus and the round muscles are there. It also, we would suggest that you stoop instead of bending over, because when you bend over, you're putting stress on that broad ligament, which is the ligament to the small of the back. You can talk with your medical provider regarding this in regard to things that you can do. Please understand that my presentation tonight is not meant to give medical advice. It is meant to give you medical information. I'm not your medical provider. You will hire your own medical provider and recommend that you work with them for the guidance of your care during your pregnancy and birth experience. The one other thing that will not be shown on this is the leg cramps. Women will complain of leg cramps often. Leg cramps are due to the need for more calcium and magnesium in your body. Your baby is growing, your baby bones are growing, and the baby is going to take the calcium that it needs from you. And so if you do not have enough calcium within your body, then your baby is going to leave you deficient. So then there's the need to replace calcium. Now, some women are lactose intolerant. They cannot drink milk or eat ice cream. There are other ways to get calcium, such as through sardines, green vegetables. These are other ways that you can get calcium. My recommendation for women is that you have time with a dietitian who can give you advice on your diet so that you can look at all that you're needing throughout your pregnancy for your health as well as for the baby's health. As we mentioned in the pre-pregnancy episode, that you will begin taking a multivitamin hopefully before you become pregnant. This will help get your body ready for pregnancy. So hopefully you can get a good store of minerals, vitamins that you're needing. So these are things that happen. This is what happens with your body when you become pregnant. These are normal changes that occur. And with those normal changes, there's some normal complaints that come about. So next time we will talk about danger signs. Those are the things that move beyond the point of being normal. So I hope that you have enjoyed the information that I've shared with you tonight. I hope that you will share this information and this video with your friends and with your family, that you will like. I hope that you will subscribe to my channel. That will give you notification for the next topics that come up. I'm excited to say that I'm hoping to have some live interviews soon. But anyway, thank you so much for joining again. Have a great evening. Thank you. See you tomorrow. Bye-bye.